Well, this week marks 20 years since Hurricane Katrina hit New Orleans. And this afternoon, we are taking a look at the impact the storm had on the medical community. Evacuations and closures were especially difficult for people with chronic illnesses. But two former city health directors decided they needed to do something. They sat down with our New Orleans sister station, WWL.
Watched all the wind blow, the palm trees almost coming over, and all the debris in the patio. We were here when the eye came, and then the eye left.
This is a flash flood warning.
Went outside, walking around, people were starting to clean up. Nobody had any idea that the levees had fell and most of the city would soon be underwater.
Here it comes, it's in the house.
When you were seeing the accounts of what was going on back in New Orleans, you were in Baton Rouge, what went through your mind?
Well, it was really unbelievable. It really was. It was incomprehensible just to see the damage and the devastation that had taken place in our city.
Two former New Orleans health directors. One stayed in his home on the higher grounds of the French Quarter. The other knew she needed to leave hers in flood-prone New Orleans East. Still, each took action amidst the crumbled healthcare infrastructure in Hurricane Katrina's aftermath to make sure people got medical care. And as you'll see, it was a far cry from a traditional doctor visit.
We actually went out in our cars. We had supplies. We were able to help and assist and all. So that's what we started out at. There were lots of people who didn't have their medications. We had people who were in treatment for cancer. They were in chemo treatment and they were disconnected.
Back home, Dr. Sheila Webb learned she had 5 feet of water in her home. But now, as an evacuee in Baton Rouge, she knew her many patients there, evacuees themselves, who depended on the nonprofit primary care clinics, X-Health, where she's director, were now depending on her.
God bless them, because there are a lot of people out here that are sick and don't even know they're sick, And without that trailer, X-Health, being over there, I really don't know where, a lot of us would end up.
After the storm, Johnson & Johnson documented the innovation, the dedication of people displaced themselves, and how X-Health brought health care to the many who were displaced, many without private insurance.
Even though we in Baton Rouge, I feel like I'm in New Orleans. The people are so warm. They were so glad to see me. It was a good feeling that they remember me, and I'm looking at all the familiar faces, and it is home. To be honest with you, this is the first touch of New Orleans I had since I've been gone. It really has.
Even though everything here had been disrupted, you're still very mission driven in terms of providing services. And now I am a nurse. That is my calling.
Dr. Webb and her dedicated team went to shelters, FEMA trailer camps, churches, got a mobile unit, and later opened a clinic for the displaced.
What would have happened to these people if it hadn't been for what you did?
Care would have been delayed or possibly denied. Maybe conditions would have worsened.
Meanwhile, back in New Orleans, Dr. Bropson Lutz moved into action as well.
We would raid a drugstore every now and then with the cops letting us in, and that's the way we got supplies. Then we found out that FEMA actually had a first aid station in the quarter. It was in the bowels of the Royal Orleans Hotel. You had to go through 2 security checkpoints to get there. I don't think they ever treated anybody. There were some doctors from out of town that FEMA had hired, and they just were sitting there with nothing to do because nobody even knew they were there.
So Dr. Lutz hung out a different type of shingle for his medical practice right on Dumaine, a makeshift sign that read, French Quarter Health Department in Exile.
We had people that would run out of medicines. A lot of VA psychiatric patients would run out of medicines. We had a lot of lacerations come by, and a lot of skin and soft tissue infections, a lot of staph infections. For some reason, everybody wanted a tetanus shot. So we must have given 200 or 300 tetanus shots out on Dumaine Street.
You could have left, you could have stayed comfortable, but you chose to help just treat strangers. Why?
If I had left, I wouldn't know what was going on down here. and I had this fear of not knowing what was going on in the quarter.
While the need to triage those with injuries and infections is long over, one serious health care need still lingers to this day: mental health conditions and not enough professionals to treat everyone.
And so you have this storm that essentially, disrupts life as we knew it. And many people, had to leave. Those support systems, one of the major things that makes a difference in your life when you're in a crisis is the level of support that you get.
Closing the third floor of Charity Hospital, I don't think this city has recovered yet from the third floor being closed. They didn't keep them 3 days and discharge them like it's done now. They would keep them sometimes for weeks until they were stabilized on their medication and really had an aftercare plan.
Since Katrina, there have been significant advancements in electronic medical records. This will help if you need treatment in a new location for future evacuations. More primary care clinics have opened around the city, and there is telemedicine for remote treatment. But with the wait times to get in an appointment, the patient portals that have replaced an old-fashioned phone call from your doctor, there is still nothing that compares to the one-on-one treatment by physicians and nurses who care.
She saw the need that I had. She saw the pain that I was in. She done everything she could. She came here to my trailer when I got home out the hospital. First doctor visit I think I ever had, a home visit for a doctor to come knock on my door and see about me. But I don't know, without Dr. Sheila Webb, I don't think I'd be standing here telling y'all this story today.
Meg Farris, WWL, Louisiana.
And Friday at 9, you can watch our New Orleans sister station special, Katrina, the storm that changed us. That'll be available on the free WHS 11 Plus app.